This is medical assessment from the perspective of the candidate going through the station. Scene safety, BSI. I'm going to consider the nature of illness. In this case, it's a trouble breathing call. Number of patients, I have one patient. I'm going to consider the need for additional resources. I'm going to make sure ALS is en route. At this time, I'm going to form my general impression. I have a 50-year-old male. He has trouble breathing. He looks like he's leaning forward in a tripod position. It looks like he's using accessory muscles. I'm going to approach the patient and get his level of consciousness. I'm going to ask him person, place, time, and event. Sir, can you tell me what your name is? Can you tell me where you are right now? Can you tell me what time it is? And can you tell me what you were doing when this happened? At this time, I'm going to check the ABCs, starting with the airway. Sir, would you open up your mouth? I want to make sure there's no obstructions in there. I'm going to look inside the mouth. I'm going to look for any obstructions, swollen tongue, any types of injuries to the airway. The airway looks clear. At this time, I'm going to check the breathing, and can I have the rate, rhythm, and quality of breathing? The examiner will give you that information. At this point, I'm going to put oxygen on. I'm going to use a non-rebreather mask. I'm going to set the tank to 15 liters per minute. Now I'm going to check the circulation. I'm putting my hand on the patient's radial artery. I'm checking his pulse. The examiner will give you the pulse. I'm also going to place my hand on the back of the patient's forehead. I'm looking for skin color, temperature, and condition. At this point, I'm going to make a visual check of the patient for any signs of bleeding. And I'm going to ask the patient, "Sir, have you been bleeding at all?" At this point, I'm going to make a transport decision. I've completed the ABCs, the initial assessment, and I'm going to determine this person is a priority patient, priority 1. Now I'm going to get the history of present illness. I'm going to do the OPQRST and sample questions. Starting with O. Sir, can you tell me if this feeling came on very quickly or if it built up gradually? P. Provokes. Sir, do you do anything that makes it better or worse? What seems to provoke this getting worse? Q is quality. Sir, can you use your own words to describe the feeling that you're having, how hard it is to breathe, what it feels like? R is radiate. Sir, do you have any pain, and does it radiate anywhere in your body? S is severity. Sir, on a scale from 1 to 10, with 10 being the worst, 1 being the least, please rate how this feels for you. And T is time. Sir, about what time did this feeling start come on to you? Now I'm going to ask the sample questions. The first is signs and symptoms. And for signs and symptoms, I see that the patient was using accessory muscles. I know that he's having trouble breathing. I know his respirations are high. And that's it. A. Allergies. Sir, are you allergic to anything? Medications, food, any environmental allergies, any allergies at all? M. Medications. Sir, are you prescribed any medications? Do you take any medications? Do you take anything else over the counter? P. Past pertinent medical history. Sir, can you tell me medical history as it relates to what's going on here today? L. Last oral intake. Sir, please tell me what you ate or drank and when that was. The last thing you ate or drank. And E is events. Sir, what were you doing when this feeling came on? At this point, I have the history of present illness, and I'm going to start my focused assessment. This is a trouble breathing call, so I'm going to focus on the airway. I've already inspected the airway. Now I'm going to look at the neck. I'm going to bare the chest. I'm going to inspect, palpate with my hands, and auscultate with the stethoscope. And I'm going to look for any indications of what's causing this trouble breathing. Now I'm going to check the vitals. I already have the pulse and the respirations. Can I have the blood pressure of the patient, please? I'm also going to check the pupils, and now I have the vitals. At this point, I'm ready to provide medications. I'm going to state to the examiner whether I have standing orders to use this medication or if I need medical control. I'm going to administer the medication. Before I do, I'm going to make sure I have the 5 rights. I have the right patient, dose, time, route, and right documentation. And at this point, I'm ready to transport. We're in the ambulance, and I'm going to recheck the initial assessment. I'm going to recheck my vitals every 5 minutes because it's a critical patient. I'm going to check my interventions, which was the medication. I'm going to consider if I need to administer a second dose and if I need medical control for that. And I'm going to check the intervention of oxygen that I provided. The end.